Have you ever stopped to wonder, what could be the long-term effects of teenage obesity? It's a pressing issue, with a growing number of teenagers tipping the scales into obesity. Unraveling its long-term effects is paramount for their future health. Stay with us as we delve deeper into this crucial topic. Firstly, the most visible long-term effects of teenage obesity are chronic health conditions. High on this list is cardiovascular disease. When excess fat accumulates, it can lead to heart diseases by increasing blood pressure and cholesterol levels. It's like a highway with too many cars, causing traffic jams and accidents. Next, we have type 2 diabetes. This is a condition where your body can't effectively use insulin, the key that unlocks cells to let sugar in for energy use. Imagine a key that doesn't fit into the lock anymore. That's what happens when obesity interferes with insulin's work. Lastly, let's talk about joint problems. Carrying around extra weight puts more pressure on your joints, especially the knees and hips. Think of it as carrying a heavy backpack all day, every day. These conditions can significantly hamper the quality of life, but they are just the tip of the iceberg. Beyond the physical, obesity can also have serious implications on mental health. It's important to understand that the effects of obesity aren't just skin deep. The constant struggle with weight and appearance could lead to the development of low self-esteem. This, in turn, can create a vicious cycle where the individual may overeat as a coping mechanism, leading to further weight gain. Moreover, the social stigma and bullying associated with obesity can lead to feelings of isolation and sadness. This potentially paves the way for more severe mental health issues such as depression and anxiety. In fact, research shows that teenagers who struggle with obesity are more likely to experience these mental health conditions. These psychological impacts can be persistent, often extending into adulthood. They can affect an individual's personal, social, and professional life. The scars of these mental health issues can remain long after the teenage years. Obesity doesn't stop at affecting the heart, joints, and mind. It can also increase the risk of certain cancers and reproductive issues. Let's delve into that a bit more. When it comes to cancer, the connection with obesity might not be immediately apparent. But research shows that being overweight during adolescent years can significantly increase the risk of developing certain types of cancer later in life. This includes breast cancer for girls and colon cancer for both boys and girls. The reasons are complex, but they involve changes in the body's hormone levels and inflammation caused by excess fat. Moving on to reproductive issues, obesity can interfere with the body's hormonal balance, leading to complications such as polycystic ovary syndrome in girls and reduced sperm quality in boys. These issues can lead to fertility problems down the line. Clearly, the effects of teenage obesity are far-reaching and multifaceted. Lastly, the economic impact of teenage obesity cannot be overlooked. This is a ripple effect that starts with the individual and extends out to society as a whole. Obesity-related healthcare costs are skyrocketing, and these expenses aren't just about treating the obesity itself. They also include the cost of managing the chronic health conditions that often accompany obesity, such as cardiovascular disease, type 2 diabetes, and joint problems. But the economic impact doesn't stop at healthcare. There's also the potential for reduced earning potential. Chronic health conditions can limit a person's ability to work or even pursue education, which can lead to lower income levels over their lifetime. This not only affects the individual and their family, but also reduces the overall productivity of our economy. So, while the physical and psychological impacts of teenage obesity are certainly significant, the economic implications are just as critical. As we can see, the long-term effects of teenage obesity extend well beyond the personal, affecting society as a whole. So, what does this all mean? Let's take a step back and reflect. We've discussed how teenage obesity can lead to chronic health conditions like cardiovascular disease, type 2 diabetes, and joint problems. We've explored the mental toll it can take, leaving a lasting psychological impact. We've even touched on how it increases the risk of certain cancers and causes reproductive and fertility issues. And we can't forget about its economic implications. These are not isolated issues, but a woven tapestry of potential consequences. That's why it's crucial to address teenage obesity now, to prevent these long-term effects. Remember, it's not just about the number on the scale. It's about a lifetime of health, happiness, and potential.